Antimicrobial drugs, including antibiotics, save lives and are an important part of healthcare. But overuse of these drugs for decades has created a situation known as antimicrobial resistance, or AMR, where the medicines lose their effectiveness.
A world in which the drugs don't work is a threat to global health security that must be addressed with the same urgency as a sudden and deadly outbreak.
Antimicrobial resistance is driven in part by the use of antibiotics in livestock. The animals can develop drug-resistant bacteria that are passed on to humans through meat. Last November, the World Health Organization released new guidelines limiting use of antibiotics to sick animals and only allowing drugs deemed least important to human health to be used in livestock.
A huge amount of antibiotics are used by agriculture. In some countries, up to 2/3 of antibiotics are used by agriculture. Some of these are for treating sick animals, but some of them are for non-health purposes, basically as growth promoters. And we feel that this is helping to fuel the development of AMR.
But the U.S. Department of Agriculture has rejected those new guidelines, arguing that antibiotics can be safely used in healthy animals to prevent disease, not just treat disease. A statement from the USDA's top scientist reads in part, "The WHO guidelines are not in alignment with U.S. policy and are not supported by sound science." Public health advocates argue the guidelines protect the well-being of people.
To say that they're not science-based is really wrong. These were actually generally much more science-based than actions taken by the USDA or the US FDA.
Critics say the USDA approach allows farmers to claim they are using antibiotics to prevent disease while actually using the drugs to promote growth, yielding more profitable animals, but allowing more antibiotics into the human population and increasing the risk of antimicrobial resistance. Livestock producers are urging the USDA to push back against the WHO standards. They fear that American meat will be banned in foreign markets if the guidelines are widely adopted.
For a lot of the public health groups in the U.S., we really think the WHO standards are the right way to go. I mean, the problem of antibiotic resistance is a huge global problem. We're kind of sad that the government in the United States is kind of not on the lead, but it's kind of trying to put the brakes on doing more to fight this really big global problems.
The U.S. Department of Agriculture says more research is needed to develop policies addressing antimicrobial resistance, and it says it will work with the WHO to develop guidelines the U.S. finds acceptable. Jim Spellman, CGTN, Washington.